Bones aren't just rigid scaffolding. They're living, changing tissues that grow, repair, and constantly remodel. In the next 15 minutes, we'll look at how bones form and grow, what happens when they break, how bone healing and remodeling work, and the basics of osteoporosis, why it happens, and how to lower your risk. Let's get started. First, what is bone? Bone is a living connective tissue made of cells and a mineralized matrix. The main cell types are osteoblasts, build bone, osteocytes, mature bone cells that sense mechanical load, and osteoclasts, resorb bone. The matrix contains collagen for flexibility and hydroxyapatite, calcium phosphate, for strength. Bones form in two main ways during development: intramembranous ossification, flat bones like skull and clavicle, and endochondral ossification, most long bones. In endochondral ossification, a cartilage model grows first, then is gradually replaced by bone. Long bone lengthening occurs at the growth plate, or physis, a layer of cartilage near the ends of bones. Chondrocytes divide and push the bone apart. Cartilage is calcified and invaded by blood vessels and osteoblasts, which replace it with bone. Growth plates close after puberty under hormonal influence, ending longitudinal growth. Bone thickness and shape change through modeling. Osteoblasts and osteoclasts act on different surfaces to adapt bones to mechanical stress, a process influenced by activity, nutrition, and hormones. Even in adults, bone is dynamic. Remodeling is a coordinated cycle of resorption by osteoclasts, followed by formation by osteoblasts. This replaces old or micro-damaged bone and helps regulate blood calcium. Activation, resorption, reversal, formation, mineralization. Mention basic timeline. Typical remodeling unit takes 3 to 6 months depending on bone site. Remodeling is targeted to microdamage and also influenced by systemic signals like PTH, parathyroid hormone, calcitonin, vitamin D, sex hormones, and by mechanical load sensed by osteocytes. When a bone breaks, many things happen at once. Fractures are described by pattern, transverse, oblique, spiral, comminuted, and by whether skin is broken, open or closed. The immediate responses include bleeding, inflammation, and initiation of repair. A fracture tears blood vessels and forms a hematoma that brings inflammatory cells and growth factors. Within days, a soft callus of cartilage and fibrous tissue forms, bridging the gap. Later, that callus is replaced by hard woven bone, and over weeks to months, remodeling converts woven bone into stronger lamellar bone. Bone healing occurs in overlapping stages. 1. Inflammatory phase, first few days. Hematoma, immune cells, signals. 2. Reparative phase, days to weeks. Soft callus, cartilage, then hard callus, woven bone. 3. Remodeling phase, months to years. Woven bone reorganizes into lamellar bone, restoring shape and strength. Stability at the fracture site matters. Too much movement can prevent healing. Appropriate stabilization, casts, plates, nails, helps the healing cascade proceed. Several factors affect healing speed: age, blood supply, fracture pattern, infection, smoking, medications, e.g. high-dose steroids, some NSAIDs, nutrition, protein, vitamin C, vitamin D, calcium, and systemic disease like diabetes. Sometimes healing is delayed or stops, called delayed union or non-union. Causes include poor blood supply, large gaps, infection, insufficient stabilization, or metabolic problems. Treatment may involve bone stimulation, revision surgery, bone grafting, or addressing underlying medical issues. Osteoporosis is a condition of low bone mass and microarchitectural deterioration, leading to increased fracture risk. It's common with aging, especially in postmenopausal women due to lower estrogen, a hormone that normally restrains bone resorption. When remodeling balance shifts, more resorption than formation, bones lose mass and become porous. Common fracture sites: hip, vertebrae, wrist. Risk factors: age, female sex, family history, low body weight, smoking, excessive alcohol, glucocorticoid use, low calcium vitamin D, sedentary lifestyle, certain medical conditions and medications. Bone density is measured by DXA, dual energy X-ray absorptiometry. T-scores compare to young adult peak bone mass. T-score, Oz, 2.5 is osteoporosis, 1 to 2.5 is osteopenia. Treatment and prevention: lifestyle first, weight-bearing and resistance exercise, adequate calcium and vitamin D, smoking cessation, limit alcohol. Medical therapies when indicated: bisphosphonates, denosumab, selective estrogen receptor modulators, PTH analogs, and newer agents, prescribed based on fracture risk and medical profile. Key takeaways: bones are living tissues that grow, heal, and constantly remodel. Proper stabilization and good biology are essential for fracture healing. Osteoporosis is preventable and treatable. Exercise, nutrition, and medical care reduce risk. If you're concerned about bone health or have a fracture, talk to your healthcare provider about evaluation and management. If you found this helpful, like, subscribe, and hit the bell for more science-based health videos. Leave questions below. I'll answer them in future episodes.